today we're going to talk about eye care, looking after your eyes.
Well, my name's Scott Watkin and I'm Seeability's Eye to Eye Ambassador. So I work in the advisory services with Martin and the rest of our team. I'm going to talk about my experience of using eye care. I was born in London and I went to school in London too. And I went to a special school, and my sight problem was identified when I was at school at the age of 5, between 5 and 8. I can't remember the exact age, but it's about that. And then I was bullied a lot at school, and we think that's to do with my learning disability, but also it could have been to do with the problem that I could not see very well. I went to the optician with my mum, and the optician said to my mum, because they didn't talk to me in them days, because they didn't think in those days people with learning disabilities understood, but actually they're wrong. And so I went to the optician, and they said to my mum, well, actually we can't tell you what the problem with Scott's eye condition is here, because we need you to go to the hospital and go to the eye clinic in the hospital. And my appointments can take up to 5 hours. And so when I went to the eye clinic, they told my mum that I had a condition called keratoconus. And if you can imagine looking through a frosted glass window, what can you see?
Nothing.
Nothing. Well, that's what my sight was like for 28 years of my life. So actually, it's really important. Then I moved to the Isle of Wight, and I went to a day centre because social services decided that I needed to go and interact with other people. And I sat in this day centre, and one day we had somebody from the Valiant People team come down from the Department of Health and being shown around, and this person was talking to me, and I said to them, well, I sail, I like sailing, and the manager of the day centre said, well really Scott, we didn't know that you liked sailing. Is this true? And I was like, well actually I wouldn't have said it if it wasn't true. So anyway, the person from the Department of Health said, well Scott, I think you're wasted here and we need to make sure there's lots of other opportunities for you and to do lots more. So then I co-chaired my partnership board for 6 years and went to work at Summerfield, and my contact lens broke while I was working, and the staff said well, that's naughty, isn't it, Scott? You broke your own contact lens. And I said, no, I didn't. It fell out of my eye, and it's cracked in the middle. And so then I left there, basically. But I got the opportunity to go to a fantastic hospital called East Grinstead Hospital. So they gave me options, and I had options around doing having plastic rings inserted into my eyes to make sure the cornea was flat again, and that worked for a while. But then they gave me a corneal graft, which is a piece of cornea from someone else's eye put into my eye, and actually that was successful. So I'm standing here today with 2 successful corneal operations with the support of Seeability and Martin and the team and my family, and actually if I wasn't standing here I'd probably be sitting at home eating Pringles, watching the TV or playing my Wii. So actually that's my story, and thank you.
Was that Scott was able to start at the beginning of looking after his eyes and go all the way through to having an operation that led to Scott being able to have better sight and to achieve his own potential. And that's only 7 years ago. 7 years ago, people were still saying, are you sure someone with a learning disability can have these operations? Are you sure someone with a learning disability can improve their sight and get work or reach their potential? But some of the really important things here are that people with learning disabilities, it's a shame but it's true, are 10 times more likely than other people to have sight problems. But what's also true, and sadly, is that people who support people with learning disabilities don't know that. So we have people more likely to have sight problems with staff and carers not knowing they're likely to have sight problems. So that's not a good way for people to get good eye care. So, opticians, or they're sometimes like to be called optometrists, which is a tricky word for anybody to say.
Yeah.
Optometrists. So we'll call them opticians. You should have your eyes tested with an optician every 2 years. And that should be in your health action plan to remind yourself to go. And information about your health, your eyes, and what happened at your eye examination also it ought to be in your health action plan if you choose to have a health action plan. You don't need to be able to read or write to have an eye test. Lots of people think, I can't go to the optician because I don't find reading easy, or I can't talk. But you can have a good eye test that sees whether your eye is healthy, or how you're seeing, or how your glasses need changing, even if you don't talk, even if you don't read.
And also, the people with the most complex needs can have an eye test too. So it doesn't matter whether you can't communicate with the optician or at the hospital, everybody can have an eye test.
But we do hear that people go to the opticians wearing other people's glasses. So you need to wear the right glasses for the right job. And people who support people need to know which are the right glasses for the right job. Thank you for that. To get the right eye care, thanks Scott, is to go to the optician. To be supported by people who understand how important eye care is. And if the optician understands how important people with learning disabilities eyesight is, he will then he or she will make an appointment for you to see other people. Like eye doctors if you need a cataract removed. Like help from trained staff who can help with communication. Like help with people who can help you walk, help from people who can help you walk and maintain your independence. And help to make your cup. This here is a little gadget called a liquid level indicator. Who knows what that might do? That strange series of words, liquid level indicator. When you pour your cup of tea into your cup and the liquid gets up to a certain level, that little machine goes beep, 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 so you know to stop pouring.
Oh, thank you. That's clever.
People with learning disabilities have the same equal right to get all this support from going to the optician
As anyone else.
to having support for complicated eye operations. The key thing is having the support to get it done.
So Seeability have a website, okay, and on that website we have a section there about my eye care, and that's got all our easy read stuff to make sure that people with learning disabilities can access the information to help them get a good go get prepared for the optician or to find out about their conditions. Or you can phone us up and we can make an easy read sheet for you.